The study that I researched focused on a treatment protocol that targets prosody and segmental accuracy of speech in children with childhood apraxia of speech. I chose this article because I've always been interested in apraxia, especially in children, but I don't know much about the treatment of it, so this was a great way to learn more. The study examined the use of orthographic stimulus during rapid syllable transition training, also known as ReST intervention. It was hypothesized that the 4 participants who all had history and current diagnosis of apraxia of speech would show improvements in the ability to produce correct strong weak and weak strong stress patterns in both the treated and similar untreated 2-syllable pseudowords. So an example of strong weak would be the word basket, and an example of a weak strong word would be cartoon. It was also hypothesized that the treatment effects would remain up to 4 weeks post-treatment and would generalize to connected speech as well. The treatment consisted of 12 one-hour sessions, and flashcards were presented to the child one at a time. On each flashcard was a 2-syllable pseudo-word that was orthographically biased to either a strong weak or weak strong stress pattern. The clinician gave corrective feedback to the participants only during the first 10 to 20 minutes of the treatment, and then after the 20 minutes was up, the flashcards were presented to the client in random order, but the only feedback given was the words good or not good. And for a word to be considered correct, both the stress pattern and all segments or sounds of the word had to be accurate. The results varied for each participant, but each participant showed improvements in prosody and segmental accuracy. So it can be concluded that prosodic impairments in children with childhood apraxia of speech can be treated using ReST intervention in conjunction with orthographic biased stimulus. One strength of this study is that if the reading ability is there in the client, then he or she can just practice it on their own, because I know a big complaint is that parents can't find the time to practice enough with their child, so this is a great tool if that is the case. And a weakness is that the experimental group was so small, there was only 4 participants, so the data may not be considered reliable. The evidence clearly shows positive treatment outcomes, and it also goes into detail about the biased lexical stress patterns, like what they look like and why it's easily generalized by the children. But one thing that I still would like to know, it would be helpful to see this done on a larger group to see the effects that it has on more children with childhood apraxia of speech.